Welcome you all to the first meeting of the first ever meeting of the Senate Standing Committee on Families and Children. This is for the 2023 regular session. I'm very excited to be here. Not a committee chairmanship that I expected to get, but it's one that I'm very excited about. And I think we're under a lot of pressure with the emphasis that has been put on this committee with the topics that we are within our jurisdiction. And it's a challenge that I take very seriously. And I'm very excited about the things that we can get accomplished working with the other chamber and working with the cabinet. I had my first meeting with Secretary Friedlander yesterday, and I'm very excited about working with him and the commissioners and getting some things accomplished that address our children and our families within the Commonwealth, in that we can put more emphasis on these things and they're not part of a larger committee. So very excited about that. Before we get started, I would ask the clerk to please call the roll.
Senator Alvarado.
Here.
Senator Girdler. Senator Harper Angel. Here. Senator Mays Bledsoe. Here. Senator Meredith. Here. Senator Tishner. Here. Senator Webb. Here. Senator Westerfield. Senator Wise.
Here.
Senator Rocky Adams. Chairman Carroll.
Here. We do have a quorum. We do have some members that are not present. Hopefully they will be here shortly. I do want to introduce a couple new members to the Senate that are part of this committee. I'm very excited to have them here. And that's from Senate 12, District 12, Amanda Mays Bledsoe. Wave your hand so we know who you are. And then we also have from Senate District 6, Senator Lindsay Titchener. Where's she? Down here? Okay. Welcome to both of you all. And before we move forward, I also like to have to introduce the committee staff, and that's really kind of the purpose of the meeting today, is to get everyone familiar with each other and then kind of go over general what the jurisdiction is of this committee, and kind of give some general ground rules on how we're going to handle the committee and some of the things that will be priorities. And then we're going to let Mr. Secretary to speak and introduce himself and talk a little bit about with the executive branch side and how the interactions will go with this committee and whatever the Secretary would like to say. So first, our lead analyst, lead staff, Samir Nasir. Did I pronounce that right in the last name? Okay. And looking forward to working with Samir. Ben Payne, analyst. Logan Bush, analyst. Becky Lancaster, committee assistant. And then we also have Eric Rodenberg, a graduate fellow. Eric, where are you? Welcome. Moving on to the next item. If you all will look in your package, you'll see the jurisdictions for this committee. And we will be covering, obviously, issues dealing with families and children, matters pertaining to child welfare, adoptions, assistance to children, children's homes, commitment and care of children and families, child protective services, adult protective services, state guardianship, caregiver support services, child support programs, support of dependents, family preservation programs, social service programs, child care, senior citizens and aging, disabilities, rape crisis centers, domestic violence shelters, sexual assault programs, and then the public assistance programs all fall within the jurisdiction of this committee. My plan is to work with my counterpart down in the House, and in each one of these categories to try to set priorities for each one of these. What are the most pressing problems that we have? And as we spoke with the Secretary yesterday, what I see right now is probably the priority for this committee is to address child abuse and neglect within the Commonwealth. And I think I saw some numbers the other day that we're still like number 43rd. I think it's the number that I saw in the country in this category, and that's completely unacceptable. And I'm hopeful that within this committee that we can focus on specific issues and really make an impact in these issues, whether it be one at a time, but to really make an impact and not just touch on a little bit of everything, but have significant impact on those things that are most pressing. And I'd like to introduce the vice chair of this committee, Julie Rocky Adams, and it's an honor to have her here. And with her experience is something that I will lean on very heavily, and probably more of a co-chair model than a vice chair, simply because I have that much respect, and I know her heart is in these issues also, and I look forward to working with her throughout the next few years on this committee. I do want you all to know that the cutoffs for any amendments or committee subs will be 1 p.m. on each Monday, and we will get the agendas out to you on Mondays also. Yeah, that's okay. And the meetings are at 9 o'clock on Tuesday, and I would ask that you please be prompt. It's always very frustrating in committees when you can't get a quorum, and the work of this committee is extremely important, and especially during the session, we will need you all here. If you have problems or something comes up you can't be here, I'd ask that you please contact Samir or myself so we know where you are and we know what to expect. Okay. Another thing that I want to mention is during the session, if there are particular meetings that we have that perhaps we may not have maybe one bill that we'll be hearing during that particular meeting, we're going to use that time to help educate the committee. We have new members, and on topics that will come before this committee to give some background on these various topics, because I think that would be very helpful. And if we have an hour, and we will only have an hour for each meeting, so that's something that we're going to hold as close to as possibly can. We can, but for me, that normally means it's probably going to last an hour and a half to 2 hours, because I like long meetings. But I have been advised that it's going to have to be an hour, so I'm sure I'll get a lot of elbows to cut it off. So we're going to use the time as efficiently as we can and educate as much as we can for the new committee members. That's about all I can think of. And, we'll go ahead and get him. Secretary Friedlander, if you want to come to the table, sir. And as I said, I'm very excited about working with the Secretary and some of the goals that the Cabinet has. And I think we're on the same page in a lot of areas. And this is not what we deal with are not political issues. These are dealing with our families and with our kids. And I think it's crucial that the legislative and the executive branch work together, and I'm extremely confident that that's going to happen, and that'll be, I think, a good relationship, and I think we'll be successful. Secretary Friedlander, if you would please introduce yourself for the record, and also have those seated with you at the table introduce themselves, and you have the floor.
Thank you. I appreciated the opportunity to meet with you yesterday. I know many of you, but I do want to reintroduce myself for those who are new. My name is Eric Friedland. I'm Secretary of the Cabinet for Health and Family Services. With me, I have my really kind of leadership team in the Secretary's office, and I will ask them to go ahead and say their names, and then we'll move on.
Carrie Banahan, Deputy Secretary, Cabinet for Health and Family Services. I've worked in state government for over 37 years. Of those, 29 have been with the Cabinet, 8 with the Department of Insurance, and I look forward to working with the committee. Thank you.
I'm Sarah Cooper. I am the Legislative Liaison for the Cabinet, and I have been with the Cabinet for a little over 20 years.
Hello, my name is Jackie Richardson. I serve as the Chief of Staff and have been with state and local government for over 27 years. Look forward to working with all of you.
And Eric Friedlander. I started work with the Cabinet in 1985. Some people in the audience weren't born yet, and I try not to hold it against them. But it's all been with the Cabinet. Several different names, Cabinet for Human Resources, Cabinet for Families and Children, Cabinet for Health Services, and now Cabinet for Health and Family Services. And within that time, I've served in appointed positions, both for Democratic and Republican governors, as both have Jackie and Carrie. So I say that as a bit of a way of introduction to hopefully understand that we will and pledge to work with you all as we can. And so a tiny introduction on the Health and Family Services Cabinet. It is a huge cabinet. There are a few states. They're all set up differently. Probably about 13 that have these giant cabinets. Then there's different types of state setups where there are county-based systems and state-based systems. We have a state-based system. So lots of different ways that states set these up. There was a task force, CHFS task force in the interim, and we really discussed what I see, because I've been working for this cabinet since 1985. I've seen it taken apart and put back together again. I believe it works better together, just because of the way all the funding flows, the federal government funding flows, and a lot of times when we talk about eligibility programs, they do cross. What is a Medicaid reimbursement pay for? What does it not pay for? What's health services? What's not health services? All of these things intertwine, and so I believe we're a stronger group and a stronger state as we try to work on a lot of these issues that impact across systems, child abuse and neglect. How do we address things within families early? So that we don't continue to see kids rolling through the system. Oftentimes, I'm on record with this, when we see a child fatality or a terrible outcome, it is not the first time that the cabinet has been in contact with a family or a child. And that has been true since I started with the cabinet. And so how do we continue to work on these issues so that doesn't continue to happen? So owning that it's across administrations, owning that it is across time, but also owning that we need to do something about it. So I welcome that. I applaud the General Assembly for really forming this committee. Oftentimes, at no offense to those who've done health and welfare for years and years and years, just like the cabinet, when you say health and welfare, it's Medicaid and everybody else. Always. Medicaid is, the cabinet's about $18 billion and Medicaid's 14 or 15 of that. So the attention always goes to Medicaid, hospitals, providers, nursing facilities. That's where a lot of the attention goes, and not enough attention then goes to the DCBS side, the Child Protective Service side, the Adult Protective Service side, which hardly anybody ever talks about and is critically important. So these are pieces that I look forward to working with you all over time. Childcare, I think the pandemic showed us how important the childcare industry is in terms of getting people back to work. And as the benefits cliff, again in the interim, that task force looked at the benefits cliff, past 2 interim sessions. Childcare is the biggest impact. Childcare, once you lose childcare, it's very difficult to get to work. There are kind of hard cutoffs on eligibility, income eligibility. And so House Bill 499 of the last General Assembly, we're working on implementation, but that's how we get employers to be able to provide some assistance to their employees for childcare. We're working on that. We feel like we're on schedule to get that implemented by the time that the legislation comes into effect. So I'm excited about that. It's an experiment, but I think it's a demonstration of the understanding of why childcare is important. So I want to again affirm that. I think it's great that there's a committee that looks at these issues specifically. I always talk about when there's a new secretary of the cabinet that they usually approach the cabinet from one angle. Again, often the health side, right? So being able to have the opportunity to express what is the broad impact of the cabinet, and where I think at times we could use some additional scrutiny and we could use some additional assistance to work with how we get at some of the intractable issues around child abuse and neglect, around adult abuse, that we need that attention. And I look forward to working with this committee. And so by my way of introduction, Carrie Banahan has worked in Medicaid side and the insurance side and kind of the nuts and bolts side of the cabinet for many years within the cabinet. So she has expertise. I always like to say I don't need to know everything. I need to know the people that know it. And Carrie is somebody that knows Medicaid, the health side, really, really well, backwards and forwards, connect, all of that. Sarah Cooper is a legislative liaison for the cabinet. Those of you who are new, Sarah is the point person for legislative contacts. Of course, many of you have my number. That is absolutely fine, and we talk all the time. But Sarah's the point person, questions on legislation. She helps keep us coordinated within the cabinet. So, if you call different people in the cabinet, sometimes, unfortunately, you can get different answers. We try to coordinate that. And it's not because anybody's trying to say anything different. It's just you get different people with different perspectives. The cabinet's an elephant, and that whole story about you feel the tail, you feel the toe, you feel the trunk, and you can describe it as different things. Jackie Richardson has, both Jackie and I worked at what is now the Office of Children with Special Health Care Needs. We were both the executive directors for a time, and it's a great organization to understand kind of different perspectives on the cabinet, because the Office or Commission for Children with Special Health Care Needs is a provider, works with MCOs from a provider perspective. It's also a state agency, so it does have some a special protected status, state employees, so all the things that come with the challenges of the personnel system and the state employee system we work through. So there are a lot of perspectives that you get at the Commission for Children with Special Health Care Needs that I think are important to understanding the cabinet. I always like to say when you have a smaller agency like the Commission is, the difference between it and Medicaid is just the number of zeros at the end of the budget. Still can be just as complicated. So, and you were also the Chief of Staff for Dr. Troutman at Louisville Metro Public Health. So Jackie comes with a wealth of experience on not only state government, but local government and the health department side, which is, as we've seen throughout these past several years, how important that is to have that understanding. So I just want to, that's kind of my brief introduction, and I hope I've covered, Chairman, what you would hope that I would cover.
You did, Mr. Secretary. I think we have a question. Senator Meredith?
Thank you, Mr. Chairman. Not a question, but a comment. Secretary Freelander's made numerous references to the task force, and I guess for historical perspective for our new members, this task force, which met this past summer, its purpose was to look at reorganization of the Cabinet for Health and Welfare. And I think a lot of people thought there was a hidden agenda there, but there's not. I think we're all on the same page. We're just trying to make it more efficient, more effective, more responsive to our constituents. And I'm going to commend Secretary Freelander and his staff. They did a wonderful job this summer in opening up the inner workings of each element of the cabinet, and I appreciate that. We will have a bill this session that deals with the recommendation that came out of that reorganization task force. Mm-hmm. And this committee is part of that. If you look at the jurisdiction, which you have greatly outlined, tomorrow we're going to have a brief orientation session with our new members of the Health Services Committee. You're going to see a comparable list of jurisdiction. It's overwhelming. It truly is. And when we looked at the cabinet, we also said we need to look at ourselves, because the newer members will appreciate that when we're in a 30-day session, there's a very narrow bandwidth to get things accomplished. And certainly everything that's in this jurisdiction should be a priority for us. But also on the health services side, that should be a priority for us. And again, it is our largest cabinet. I think there's over close to 7,000 employees. And again, we're just trying to do it better and more efficiently, more responsive to our consumers. But I want to thank Secretary Freelander again for his willingness and cooperation. And it's been great interaction. And we look forward to working with you going forward. But again, I will remind our committee members that we will see a bill. I don't think it'll come before this committee, probably state and local government, that deals with the specific recommendations of the task force. And that's evolving. We know it is. And one of the things that we had determined very early on was that this was not going to be a one-year task force, again, because it's so large. And it could very well be a 2 to 3 year task force. So we look forward to that as well. But again, Secretary, I want to thank you for your cooperation. Thank you. Thank you, Mr. Chair.
Senator Webb, you have a comment, ma'am?
Yes, I do, Mr. Chairman. Thank you. Good to see everybody. I came to this committee kind of as a draftee, I guess. I was a little reluctant, to be honest, until I saw the jurisdiction and those things that I started practicing law about the time Eric joined the cabinet. And lion's share of my time has been, I still practice some of this law. So as a practitioner, I'm glad to see this change. And I've had a lot of thoughts over the years, the way things could be done better. And I am on the ground in the trenches working with your field people and the challenges that they face too. So I'm glad to be here after protesting a little bit. But we're just very lucky to have the secretary, who I might refer to as Eric every now and then because I've known him so long. But I feel like any changes that we make or any efficiencies that he's going to work with us to do that and listen to our concerns. So I'm glad to be here, Mr. Chairman. I look forward to it, after all.
Anyone else? You're going to have to wait because I want to say something before we... and for members of the audience here, if you all have any questions about the committee or the jurisdiction, please take the time to come see me and we can talk about that and do understand that we're going to try to be very focused in this committee, and that includes during the interim with those meetings and really attack problems that need attention now. So please keep that in mind, but please feel free to communicate any questions that you have or clarifications that you have. For our new members, so you two can kind of get an idea where I'm coming from as chair with my experience and how it relates to this committee. 24 years in law enforcement, much of that time spent as an investigator. Investigated a lot of child abuse, neglect cases, adult abuse, neglect, sexual assault, you name it. And I did that for many years and enjoyed my law enforcement career. Now I head a nonprofit. We serve over 1,000 children and adults in our region. We have an inclusive child care, so that's part of this committee also. We have a child care facility for medically fragile kids, and we deal with a lot of therapies, a lot of Medicaid with that, and a lot of issues with child care that I deal with every day. On the adult side of it, I run a part of our center, one of our programs. We do adult services that are waiver services for adults with developmental disabilities, and we deal with a lot of Medicaid issues with that. We do respite, case management, adult day programs, that type of thing. So a lot of experience in that area, and that's really, with all those things combined, is why I had so much interest in this committee and really felt honored to be asked to chair it. So that's where my perspectives will come from as chairman and as we go through the meetings. Before we close, and I don't want to keep you all very long, wanted to keep this to a half hour. I want to mention and talk a little bit about Senator Ralph Alvarado. You all know that he's going to be leaving us, and Dr. Alvarado's become one of my very closest friends up here. And if I get emotional, I apologize. But his leadership is going to be missed here. There is no one within the Senate that works harder than this man has. And we've been here together since day one. I've got to know him very well, his family, and had a lot of discussions with him as he went through the process of making decisions for his future. My preference would be that he would be running for governor or running for lieutenant governor. That has not worked out. He was given an opportunity to be able to serve, to impact a large population in the state of Tennessee as their health commissioner. And I'm very proud of him and what he has accomplished, and I'm very proud to call him my friend. And our Senate caucus is going to be affected without him being there. His presence, his energy, his leadership, always bringing things forward in a perspective that only he had due to his experiences as a doctor, and a heart of gold. One of those people that are here in Frankfort for the right reasons, and not a political person, as evidence that he's going to an executive branch position. And I guess I kind of tried to talk him out of it during conversations, and but when he gave the final reasons. And it was through a conversation that he had with a previous secretary, I believe, that, and Dr. Alvarado, correct me if I'm wrong, but the conversation was something like, are you a physician or are you a politician? Mm-hmm. As a physician, your mission is to protect the health of as many people as you possibly can. As a politician, you're limited. And I think you can correct, I'm sure that was in much more eloquently put than I stated it, but when he told me that, it kind of helped me understand why he made the decision that he did. Even though it's not in Kentucky, he's going to be able to affect an entire state. And how many of us get that opportunity in that type of position to do that? Mr. Secretary understands that, and he understands the impact that he could have in his position. And I support his decision, as bad as I hated to see him go, and it's my hopes that he is back at some point, because I think he is capable of anything he wants to do. I have that much respect for him. And if I'm overstating all of this, I am. But that's what he means to me, and that's what my heart feels for this man, and the impact that he's made here in Frankfort in the 8 years that he's been here, and on me personally, just watching him lead. And he leads by example, and he works, and he's not afraid to stir things up. He does what's right despite the politics sometimes, and that's what it should be up here, and he sets that example. So with that being said, Senator Alvarado, I'm going to miss you, my friend, and you have the floor.
Thanks, Danny. So I'm going to try not to get emotional as well. First of all, I want to thank all of you. It's been my honor and privilege, really, to serve in these committees. A lot of legislators, I think, don't want to serve on health and welfare because they know it's a lot of stories, a lot of commentary, a lot of very long testimony from people sometimes. And so a lot of folks, there are certain committees they don't want to serve on. I think a lot of folks don't want to serve on health and welfare. I always enjoyed the long meetings, wish we had more time. And part of the reason we've created two committees, I think, is because we haven't devoted enough time to some of these topics. We've all seen our rankings in child abuse in particular, really poor for Kentucky. We've improved a little bit, which is good to see. But because of that, I think we often, as the Secretary pointed out, Medicaid is often the big giant in the room, and we devoted so much time. We had subcommittees, we'd overlap testimony sometimes. And so I think this production of this new committee was a good idea, and it allows us to put more light and focus on things that need more light and focus to improve our rankings and improve the care of those who are vulnerable in our society, which are often people that have disabilities, children, adults who obviously who are at risk as well. And this is going to allow that to happen. No better committee chairman than Danny Carroll to be appointed for this. I commend leadership for that selection. He is our matter expert when it comes to children's issues, a man with a lot of passion for people with disabilities, and I'm glad he took the role because I know that that's often a big task, and he debated about taking it as well, and I'm glad that he did. Mr. Secretary, I want to thank you. I know we've had a couple of differences here and there, but I know where your heart is, and that is everything around here, really. People can have political differences, but if their heart's in the right place, the right things get done. And you've always had that. Commissioner Lee has been great to work with, and I appreciate you very much. I may be reaching out to you for advice. I know you're going to have a lot more experience at some of these things, and jumping into the executive branch, I'll be in your position. I'm sure I'll get chewed out by legislators and get questioned about things and try to get certain responses out of me going forward. So watching you in that role and having sort of this side of it, it's going to serve me well, I think, moving forward. I want to thank the LRC staff. You all are really the unsung heroes. A lot of, for the newer members who are here, you're going to realize really quickly how much work these folks do. And people at home who watch these committees or criticize government, or these are the folks who are doing a lot of the yeoman's work behind the scenes, put a lot of these things together, make us look good. If it weren't for them, I think a lot of us would bumble through our roles. They, whether it be working in our offices, working in committees, are the folks who do the research, don't get enough thanks from us, and don't get the recognition. Sometimes they don't want it. That's why they serve in the roles they're in, but they deserve recognition at all times. And we thank you for all the work that you all do in helping us get our goals achieved here as well. But it's part of my role. Part of the conditions for me taking this is that I'll be able to maintain some of my clinical practice, because I was asked, do you want to be more of a politician or more of a doctor? And Mark Birdwhistle is the person that I talked to quite a bit. And Mark, even when I got cold feet a little bit, kind of set me straight and says, this is something that you need to do. And if you do a good job, it'll have potentially not only impact for a state, but it could be for a region if things are done and others can copy. We often look at what other states do. And so I'm hoping the governor there has asked me to be bold and to be disruptive and innovative, which is something I like to do. So I'm hoping that is something that the legislature there can follow as well, and we can get some good work done, and hoping that'll do it. I'll be in Kentucky. I'm not selling my home. Part of the condition is I can maintain some of my clinical practice, which is important. There's people that I've taken care of in long-term care for over a decade. Those are folks, their families are friends to me, and people that I've known a long time, and it's hard to get docs to do long-term care. So I'm continuing that. So I'll be up here one weekend a month, rounding on patients and still seeing them and providing services here. So you're not going to get rid of me that quickly. If I don't see things I like, I'm sure I know all your numbers, so I'll be calling you guys and barking about things and things we can do. So, but it was just flattering to have been considered and asked specifically to do that role. And so I'm looking forward to it, looking forward to the challenges ahead. And like I said, I want to thank you all. It's been my honor and privilege to serve with all of you and get to know all of you here, and Mr. Secretary as well as you. And I wish nothing but the best and Godspeed for all of you as well. So thank you.
Any other member have any questions or comments? Senator Meredith.
Mr. Chair, I certainly want to echo your sentiments with regard to Senator Alvarado. Many times people will just refer to us as politicians, and I'll correct them quickly and say, no, we're public servants, and I don't know of anybody who fits the role better than Senator Alvarado. I will acknowledge I hate to lose anything to Tennessee, but I think it's just temporary, I hope. But I also believe that the opportunity to rise out of adversity, and recognizing Senator Alvarado as probably our smartest, hardest working senator, maybe we can lower the bar a little bit now as to what the standards are for being Senator Alvarado. But really appreciate your contributions to this state and everything that you've done on behalf of our Commonwealth. And hope you find satisfaction knowing that you've left this state in a better position than when you found it. And appreciate all that you've done. Thank you.
Okay, if there are no other comments, Secretary Friedlander, I'm sorry, sir.
May I make one? I'm sorry, I know
Yes,
I shouldn't, right?
please.
But it has been an honor to work with you. I will also try not to be emotional. We've had a lot of deliberation back and forth, and you gave me a vote of confidence when I was on the precipice of decisions. And so I want to thank you for that. That had a large impact. And our relationship, both on stage and off stage, is what I like to call it, has been really good. And I appreciate the support you've given. I've appreciated when you've challenged me, right? And challenged the cabinet and challenged us, all appropriate. And I just want to thank you for your great service. And I know you can do a fantastic job in Tennessee, and I am here for you because you will be on this side. So I will be glad to be a sounding board for you, as you know. Thank you.
Very good. One other person I want to introduce that's going to be heavily involved in the committee is Eric Clark, and welcome his expertise. And I'm going to be leaning on him heavily from the perspectives that he has as being part of the executive branch in the past. And so his guidance and his advice will be well received, and looking forward to that. If there are no other questions and comments, we will stand adjourned.